Hi, I'm Dr. Krystal Voight. I'm an internal medicine and pediatrics physician at the Stillwater Medical Physicians Clinic. I started out as a junior high student who liked science and liked to help people, but I didn't really know exactly what I wanted to do with that. I had started out wanting to be a doctor, and then I was involved in sports and thought, well, sports medicine, physical therapy, that would be a great way to go. When I was a high school junior, our counselor came to us and said, any of you that are interested in healthcare, there's a new opportunity at the Stillwater Medical Center this year. One of my classmates and I applied, and actually both made it into the top 3 candidates and interviewed for the position. I was fortunate enough to be selected as the 1998 Rippy Fellowship recipient here at Stillwater Medical Center. That allowed me to get 6 weeks of shadowing through the foundation office. They schedule usually anywhere from a half day to a full day in any various specialty, so that you got an experience all across the board. Because I had expressed an interest in physical therapy, I got extra rotations there. I always say that I'm very glad that I did. I did 1 day in inpatient wound care, and I decided that was not the route that I wanted to go. But I wasn't sure exactly where I wanted to go until the last week of the fellowship. I was assigned to pediatrics at what was then the Warren Clinic. Every day that I had come home, of course my parents had to listen to me tell all about everything that I had seen and heard that day and all the things that I had experienced. But that day, it must have been different, because at the end of my stories, my mom said, "You want to be a doctor again, don't you? You don't really want to be a physical therapist." And I said, "I think I do." As part of my personal statement for both medical school and residency, we are required to write an essay type format of why we wanted to go into medicine. And actually I used stories about 2 different patients that I saw during my Rippy Fellowship for those application processes. One was a little boy that I saw during that pediatrics rotation with Dr. Bullard, and he had been born prematurely, had heart problems, and had a heart murmur. And so for the first time, someone let me listen with a stethoscope and said, "Can she listen to your heart?" Unfortunately, he was there for a well child check and in his underwear and paper clothes, and he informed me that she's not a doctor yet and she's not looking. So after promising them that I wouldn't look at his Superman underwear, he finally allowed me to listen. And ironically, when I came back, that young man had now grown into adulthood and had to transition to an adult physician. And so he actually transitioned from Dr. Bullard's practice to my practice, and he's now my patient. As I went through medical school, I thought I wanted to do pediatrics, and I really did. I loved it. And then as I started seeing adults more, I decided I kind of like this too. So then I had to figure out, what am I going to do that I can incorporate those 2 things? And so I landed on a residency that combined internal medicine and pediatrics. When I finished my residency in 2011, I had to make a decision on where I was going to practice. I had gone through thinking that I didn't want to go back home. I was terrified that I might have to treat friends or family that were important to me and give them a diagnosis that wasn't a good diagnosis. And that was, quite frankly, terrifying. As I thought more about it, though, I wanted to become involved in my community. And so I decided wherever I was going to be, I was going to end up at some point treating friends and family. And so why not come back here where it really was home? And so we made that decision for my family when we moved back in 2011. And it's been really great. This is a great place that I'm able to incorporate both the internal medicine and pediatrics side of things. I work inpatient and outpatient, so I get a good variety. But regardless of where I'm at, starting out here with the Rippy Fellowship and now coming full circle and being able to practice in some of the same areas that I rotated through as a high school student, it's pretty fun, and it's kind of amazing, actually.